If you are watching this, there is a very good chance that either you or someone you care deeply about takes a daily medication to manage high blood pressure. In the United States, more than 70% of adults over the age of 60 have elevated blood pressure. To help manage this, doctors frequently rely on three common prescription medications: amlodipine, losartan, and lisinopril. Millions of prescriptions are written for these three specific drugs every single month. They are highly effective, they save lives, and they significantly reduce the risk of strokes and heart attacks. But here is a surprising fact that many seniors and their families do not fully realize. Many of the everyday symptoms that older adults attribute simply to getting older, things like persistent fatigue, a bit of dizziness when standing up, mild balance issues, or swelling in the ankles, may actually not be signs of aging at all. Instead, these symptoms can frequently be unrecognized side effects of the very blood pressure medications they take every single morning. Understanding exactly how your blood pressure medication interacts with your body is about protecting your daily quality of life. When you do not know the difference between a natural sign of aging and a medication side effect, it is easy to assume that feeling less than your best is just a mandatory part of growing older, but it does not have to be that way. Before we dive deep into the details, I want to share an absolute rule that we will repeat throughout our time together today. Never stop, start, or change any medication without speaking directly to your healthcare provider. Your blood pressure medication is doing vital work to protect your heart, and making sudden changes on your own can be incredibly dangerous. Today, our goal is purely educational. We want to empower you with the knowledge you need so you can have an informed, confident conversation with your doctor at your next appointment. Let's start by understanding the fundamental differences between these three major medications, because even though they all achieve the exact same goal of lowering blood pressure, they go about it in unique ways inside your body. First, let's talk about amlodipine. This medication belongs to a class of drugs known as calcium channel blockers. To understand how amlodipine works, you have to look at the smooth muscle cells that line the walls of your blood vessels. These muscle cells require calcium to contract and tighten. Amlodipine works by blocking calcium from entering these cells. When calcium is blocked, the blood vessels cannot constrict tightly. Instead, they relax and widen. Imagine a garden hose. If the hose is wide and open, water flows through easily with very little pressure against the walls. That is exactly what amlodipine does for your vascular system. Doctors prescribe it because it is reliable, works steadily over a 24-hour period, and is excellent at reducing the workload on your heart. Next, let's look at lisinopril. Lisinopril belongs to a different family called ACE inhibitors, which stands for angiotensin converting enzyme inhibitors. This medication takes a chemical approach rather than a muscular one. Your body naturally produces a potent hormone called angiotensin II. This hormone is a powerful vasoconstrictor, meaning its primary job is to tell your blood vessels to tighten up significantly, which spikes your blood pressure. Lisinopril works by blocking the specific enzyme that creates this hormone. Without that chemical trigger present in your bloodstream, your blood vessels remain in a naturally relaxed, dilated state. Doctors frequently choose lisinopril not just for blood pressure control, but because it offers protective benefits for the kidneys and the heart, especially for individuals managing diabetes or who have experienced heart failure. Finally, we have Losartan. Losartan belongs to a class of drugs called ARBs, or angiotensin receptor blockers. You can think of Losartan as the close cousin to lisinopril, but with a distinct twist in how it operates. While lisinopril stops your body from making the tightening hormone altogether, Losartan allows your body to create the hormone, but it steps in to block the chemical receptors on the blood vessels themselves. It is like putting a cap over a lock so the key cannot fit inside. Because the hormone cannot attach to the blood vessel, it cannot cause constriction. Doctors often prescribe Losartan for the exact same protective benefits as lisinopril, but it is frequently used as an alternative when a patient experiences specific, uncomfortable side effects from an ACE inhibitor. What often surprises people is just how differently these three drug classes can make a person feel on a day to day basis. This brings us to a crucial topic that many seniors experience but rarely question: symptoms that are frequently mistaken for normal aging. As we cross into our 60s, 70s, and 80s, it becomes incredibly easy to blame every new physical ache, pang, or bout of exhaustion on the calendar. We tell ourselves that it is normal to move a bit slower, to feel tired in the afternoon, or to feel a little unsteady on our feet. But here is something important to understand. Chronic fatigue that leaves you feeling completely wiped out by midday might not be a lack of stamina due to age. It could be that your blood pressure medication is working a little too well, lowering your blood pressure past the point of optimal comfort and leaving your brain and muscles slightly underperfused. The same applies to leg swelling and heaviness. Many seniors assume that swollen ankles at the end of the day are just the result of poor circulation. While that can sometimes be true, it is also a hallmark side effect of certain medications. Dizziness and balance issues are another major concern. Experiencing a brief wave of lightheadedness when you stand up quickly from a chair or get out of bed is a condition known as orthostatic hypotension. While it becomes more common as our blood vessels naturally stiffen with age, it is severely exacerbated by blood pressure medications. This is not something to shrug off as just a senior moment, because dizziness directly increases the risk of accidental falls, which can have serious consequences for an older adult's independence. Even mild cognitive changes, often described as brain fog or a general feeling of weakness, can sometimes trace their roots back to daily medication dynamics rather than natural cognitive aging. A persistent dry cough that never seems to go away is another classic example. Many seniors spend months buying over-the-counter cough syrups, thinking they have developed seasonal allergies or a lingering mild cold, when in reality, a specific biochemical reaction to their medication is the true culprit. Let's break these down specifically, starting with amlodipine side effects that seniors should absolutely know about. The most prominent and common side effect associated with amlodipine is peripheral edema, which is the medical term for fluid retention and swelling in the lower legs, ankles, and feet. Many people don't realize why this happens. It is not because your kidneys are failing or because fluid is building up in your lungs. It is actually a direct result of how the drug relaxes your blood vessels. Amlodipine relaxes the tiny arteries that feed blood down into your feet, but it does not relax the veins that carry the blood back up to your heart quite as effectively. This creates a slight pressure imbalance in the microscopic capillary beds of your lower extremities. Because of this localized pressure, tiny amounts of fluid get pushed out of the blood vessels and into the surrounding tissues of your ankles and feet. This swelling often comes with a distinct sensation of leg heaviness. Your shoes might feel tight by 5 o'clock in the afternoon, or you might notice deep indentations left behind by your socks. While this fluid retention is generally harmless from a structural standpoint, it can be uncomfortable and can make walking or exercising much more difficult. In addition to leg swelling, amlodipine can sometimes cause mild flushing, a sensation of sudden warmth and redness in the face and neck, as well as mild headaches or occasional dizziness. If you notice these changes, it is important to monitor them closely. You should contact your doctor if the swelling becomes painful, if the skin on your legs looks stretched and shiny, or if the fluid retention starts moving up past your calves. And remember the golden rule. Even if the ankle swelling is bothersome, never stop, start, or change any medication without speaking to your healthcare provider. Your doctor has many strategies to address this, such as adjusting the dose or pairing it with a different medication to balance out the fluid dynamics. Now, let's shift our focus to lisinopril and the specific side effects seniors should watch for with this medication. The most famous side effect associated with lisinopril and all ACE inhibitors is a dry, hacking, persistent cough. This is where things get interesting biochemically. The enzyme that lisinopril blocks in your body is not just responsible for regulating blood pressure. It also plays a vital role in breaking down a natural inflammatory substance in your system called bradykinin. When lisinopril blocks the enzyme, bradykinin begins to accumulate in the respiratory tract, particularly in your lungs and throat. For about 10 to 20% of people who take this medication, this accumulation triggers a constant tickling irritation that results in a dry cough. What surprises many seniors is the timing. This cough does not always start the very first week you take the pill. It can develop months or even years after you have been safely taking lisinopril without any issues. It does not respond to cough drops, antihistamines, or standard prescription cough syrups because it is not caused by a virus or an allergy. Beyond the cough, lisinopril can also cause dizziness, particularly during the first few weeks of starting the drug or after a dose increase, as your body adjusts to the lower pressure levels. However, there is another much rarer side effect of lisinopril that every single senior and caregiver must be aware of, and that is angioedema. Angioedema is a rapid, severe swelling of the deep layers of the skin and tissues, most frequently affecting the lips, tongue, face, or throat. This is a localized allergic-like reaction that can happen completely out of the blue, even if you have taken the medication safely for a decade. If you ever experience sudden swelling of your lips or tongue, or if you feel like your throat is tightening, this is a medical emergency. You must seek urgent medical care immediately, as it can impair your ability to breathe safely. While angioedema is rare, knowing the warning signs gives you total control over your safety. Let's move on to our third medication, Losartan, and look at the side effects seniors should keep on their radar. Because Losartan belongs to the ARB class, it does not cause the accumulation of bradykinin, meaning it almost never causes that frustrating dry cough we just discussed with lisinopril. This makes it a popular choice for seniors who cannot tolerate ACE inhibitors. However, Losartan has its own unique set of considerations, particularly regarding potassium buildup in the body. Your kidneys are responsible for balancing the amount of potassium in your bloodstream. Losartan changes how your kidneys handle minerals, often causing them to retain potassium while excreting sodium. For many seniors, this can lead to a condition known as hyperkalemia, which simply means elevated potassium levels in the blood. What makes hyperkalemia tricky is that it rarely causes noticeable symptoms in its early stages. However, if potassium levels rise too high, it can cause muscle weakness, a slow or irregular heartbeat, or a feeling of general malaise. This is why regular kidney function tests and blood filtration monitoring are so essential when you are taking Losartan. Many seniors unwittingly complicate this situation by consuming hidden sources of potassium. For example, if you have been told to lower your sodium intake, you might purchase a commercial salt substitute at the grocery store. Many people do not realize that these salt substitutes are almost entirely made of potassium chloride. Using them heavily while taking Losartan can cause your potassium levels to spike dangerously. The same risk applies to over-the-counter electrolyte drinks, meal replacement shakes, and certain vitamin supplements. If you are taking Losartan, it is wise to have your doctor review everything you consume, including over-the-counter products, to ensure you are not accidentally overloading your system. Now, let's look at a hidden danger that many seniors never hear about, which involves how temporary illnesses and environmental factors can suddenly change the way your blood pressure medications work. When your doctor prescribes a specific dose of Amlodipine, Lisinopril, or Losartan, that dose is calculated based on your normal, healthy baseline state of hydration. But life happens. Seniors are highly susceptible to dehydration, which can occur very quickly during a bout of stomach flu involving vomiting or diarrhea, or during hot summer months due to prolonged heat exposure. When you become dehydrated, the total volume of fluid circulating in your bloodstream drops significantly. If your blood volume drops, your blood pressure naturally goes down with it. If you continue to take your full standard dose of blood pressure medication on top of being severely dehydrated, your blood pressure can plummet to dangerously low levels. This can lead to severe dizziness, profound weakness, confusion, or a sudden fainting spell when you try to stand up. Furthermore, when you combine severe dehydration with medications like Lisinopril or Losartan, it can place an intense strain on your kidneys, temporarily reducing their ability to filter toxins from your blood. A similar situation can happen during periods of reduced appetite, such as when you are recovering from a minor surgery or feeling under the weather and not eating or drinking enough for a few days. The key takeaway here is to always seek clear guidance from your physician when you are sick. If you are experiencing a temporary illness that prevents you from keeping fluids down, or if you are facing extreme heat, contact your doctor's office immediately. Ask them if you should temporarily adjust your dosage until you are fully recovered. And as always, never make that decision on your own. Never stop, start, or change any medication without speaking to your healthcare provider first. Let's talk about some of the most common mistakes seniors make when managing their blood pressure medications. Managing daily pills can be challenging, especially if you take multiple prescriptions at different times of the day. One frequent mistake is skipping doses because you feel perfectly fine. High blood pressure is often called the silent killer for a reason. It rarely causes obvious daily symptoms. When your medication is working perfectly, your blood pressure is normal and you feel great. It is easy to fall into the trap of thinking you no longer need the pill. But skipping doses causes your blood pressure to bounce back up, creating a roller coaster effect that places stress on your delicate blood vessels. The opposite mistake is just as common, taking a double dose because you forgot whether you took your morning pill or not. Taking a double dose of Amlodipine, Lisinopril, or Losartan can cause a dramatic drop in blood pressure, leading to severe lightheadedness and an increased risk of falling. Another major pitfall is what I call chasing blood pressure numbers. Many seniors own automated home blood pressure monitors. They might take their reading, see a single high number, panic, and immediately take an extra pill to force the number down. It is vital to understand that blood pressure is dynamic. It naturally fluctuates every single minute based on your stress levels, whether you just walked up the stairs, how recently you drank a cup of coffee, or if your bladder is full. A single high reading is not a reason to panic or alter your medication routine. Practical solutions can make a world of difference here. Using a clearly labeled 7-day pill organizer is one of the simplest and most effective ways to prevent both missed doses and accidental double doses. Establishing an inconsistent medication timing routine is another error. If you take your pill at 7 in the morning on Monday, but wait until noon on Tuesday, the levels of the drug in your system will fluctuate, leading to inconsistent blood pressure control. Try to link your pill taking to a firmly established daily habit, like brushing your teeth or eating breakfast, to keep the timing perfectly steady. This leads us to a fundamental truth about cardiovascular care. What makes a blood pressure medication truly right for you? What often surprises people is that there is absolutely no single best blood pressure medication on the market. A drug that works like an absolute miracle for your neighbor might make you feel completely miserable, and a medication that causes someone else to cough nonstop might give you perfect blood pressure with zero side effects. Every single human body is a complex chemical environment. Your individual response to a drug depends on a vast array of personal factors: your unique genetics, your kidney function, your liver health, your daily activity level, and any other chronic health conditions you might be managing. Finding the right medication is a process of balancing optimal blood pressure control with your individual side effect tolerance. Your long-term safety and your daily quality of life are equally important. You should never have to sacrifice how you feel every day just to achieve a perfect numbers reading on a monitor. This is why open, honest, and frequent doctor-patient communication is so vital. Your physician has a massive toolkit of different medications, dosages, and combinations available to use. If you are experiencing an uncomfortable side effect, tell your doctor exactly how you feel. They can easily adjust the dose, switch you to a different class of medication, or find a strategy that keeps your heart safe while restoring your energy and vitality. As we wrap up our discussion today, let's create a practical, actionable checklist that you can use right away to take complete control of your health. First, be highly vigilant about the symptoms to watch for based on what we discussed today. Note any new or worsening ankle swelling if you take amlodipine. Keep track of any dry, persistent cough if you are on lisinopril. Watch for signs of muscle weakness or unusual fatigue if you take Losartan, and always pay close attention to any sudden dizziness when you stand up. Second, prepare a specific list of questions to ask your doctor at your next scheduled visit. You might ask, is my current dosage still appropriate for my age and lifestyle? When was the last time my kidney function and potassium levels were checked via blood work? Are any of the daily symptoms I am experiencing potentially related to my prescriptions? Third, know exactly when to seek urgent medical care. If you ever experience sudden swelling of your face, lips, or tongue, severe chest pain, sudden difficulty breathing, or a wave of dizziness that causes you to lose consciousness or fall, seek emergency services immediately. Fourth, establish safe, consistent home monitoring habits. Take your blood pressure at the exact same times each day, write the numbers down in a paper logbook, and bring that data to your appointments so your doctor can see the big picture trends rather than a single snapshot in time. Managing your blood pressure as a senior does not have to be a source of confusion or worry. By understanding exactly how amlodipine, lisinopril, and losartan work, and by recognizing the difference between natural aging and common medication side effects, you are empowering yourself to live your healthiest, most vibrant life. Keep a close eye on how you feel. Communicate openly with your medical team. Use your tools consistently. And remember our ultimate guiding principle: never stop, start, or change any medication without speaking to your healthcare provider. Stay informed, stay proactive, and take wonderful care of yourself. I will see you in the next video.